Hello everyone, my name is Colomba. Today we're receiving one of our healthcare heroes. She's such an inspiring woman in the healthcare area. So we decided to invite her today to know more about her story, her achievements. And you know what? We've decided that nobody else than her can tell us more about herself. That's why today, please, ladies and gentlemen, welcome Mrs. Clare OMATSEYE. I'm going to introduce the topic to you. I'm going to introduce the topic to you. Welcome, Mrs. OMATSEYE. How are you today?
I'm great, thanks.
Okay, I'm happy to receive you today.
It's a great pleasure to be here.
Okay, today we're going to talk about healthcare sector. As the president, West African Private Healthcare Federation, you know, we know you, the president, and as a hero, we want to know more about you.
Thank you.
So just tell us everything from the beginning.
Well, that's a long story, so I'm not sure what you want me to cover, but I am a pharmacist.
Okay.
I have had 34 years of experience in healthcare. I see myself beyond being a pharmacist as somebody who is a medical advocate.
Okay.
I've spent over 14 years working for multinationals from May & Baker, GSK, then called Sterling, and then went on to be the executive director of Aventis Pasteur, now Sanofi. Then I went on to become the country manager for Huntley Healthcare. And then I took a plunge. I think it's, you know, after working for multinationals for 14 years, you see that there's a huge opportunity in healthcare and you're really not solving the problems. And working just for one company was not able to solve the challenges I saw in Nigeria, where I am from. And I decided to take the plunge into entrepreneurship. I didn't plan it. I didn't write a business plan.
Okay.
Everything that business school teaches you to do to become an entrepreneur, I did the opposite.
Okay.
All I could say is that I knew that there was a challenge in Nigeria. We were an equipment dumping ground. People were dumping equipment. There was no after-sales service. We were not really changing the narrative, and Nigeria required someone that was just more than an equipment supplier.
Okay.
We needed to start getting good outcomes. We needed to sweat the assets. We needed to put in the latest technology.
Okay.
And that became my mantra.
Okay.
Excellence.
Let me ask you a question. Did you have an inspiration? Did somebody inspire you to push so far things like this?
Right from the very beginning, my inspiration has always been my father.
Okay.
My father is a physiotherapist, but beyond that, he spent many, many years, of course, doing academic excellence. I remember when he did his PhD, then there was only a typewriter, and my mom used to write his thesis and how hard he had to work. And I think just watching him go through life, going from Canada to the UK, then back again doing his PhD, coming to Nigeria, going through all the resilience of multiple ministers and permanent secretaries, trying to get, you know, serve his country. And then doing an early exit to Kuwait and working in Kuwait for 9 years, and just seeing the kind of inroads that he was doing.
Okay.
He became my role model and inspiration.
Wow.
To say, look, with hard work, whatever you decide to set your mind on, you can get it. Nothing stops you.
Okay. Now I would like to know, how did you get to select people with whom you work, your co-workers? How did you meet them?
Well, I think that early in my career, as I said, I spent 14 years in industry and multinationals. There are a few people that we shared the same value system with, that we were all hardworking. We had the same kind of virtues, being hardworking, being patriotic, thinking out of the box, being innovative,
You're so passionate.
that we're passionate about things. So you share those kind of values. So when I now decided to take the plunge into entrepreneurship, of course, those are the same people that you bear in mind that, look, I don't need to bring you on. I didn't bring everybody on initially, because initially you don't have the money to pay the right kind of people.
True.
But once I knew that this could work and this will work, I brought on people that had those kind of, and I have a partner who today is the executive director of our company, JNCI.
Wow.
And he and several others were people I've worked with initially. And after that, of course, you get an HR manager to choose the brightest and best people in the industry.
Before all these steps, how did they react in the beginning? Were they excited to go with you, or how was it?
I think they were excited. Actually, people were ready to take the plunge. I say the plunge because you really are going to uncertainty. If you look at the statistics on SMEs, because we were an SME, most SMEs, 90% of SMEs fail before their first birthday.
Okay.
So anybody that decides to take that risk, leave their jobs that you're sure of a salary,
Wow.
and come and take that risk with you and grow with you, really does believe in the overall mission and vision of the leader. So I guess I must have inspired a few people to say, look, we can do this. If other countries are doing this and you have multinationals doing this, I looked at a few role models even outside that are doing turnkey. And I said from day one, excellence will be our watchword. We want to be able to do a turnkey, whether we're going to set up a small theater or an entire hospital. We want to make sure it's patient-centric, and that whatever we do well.
Please tell me about the 5 first years.
The 5 first years,
Yes.
very interesting. So we started off, of course, with just 2 or 3 people.
Okay.
It was a small office. My husband's office, I told him, you know what, I need this office straight away.
Was it in Nigeria?
It was in Nigeria.
Okay.
So I finished my last day. I had resigned my job in Huntley, and I had given my 30 days notice, and I decided I would stay back as a consultant for them, working 2 half days a week. Of course, that didn't really exist, and I would take the plunge. Somebody told me about a conference in Dubai called Arab Health, and I have a dual nationality. I got on a plane, went to Arab Health. I spent 4 days absorbing and looking around and choosing what it is that I identified as quality. And I chose some of the best partners.
I like this, the word absorbing and looking around.
Absolutely.
Okay, wow,
I
interesting.
became a sponge, and I tell anybody that learning is a continuum. Even at this age, anyone that stops to learn, you actually fail. So you must continue to be a walking encyclopedia, learn from young people, learn and give back, but I think learning is a continuum. So I became a sponge for knowledge. I sat in that room, made sure that every major stall that I liked, I got their brochures, and somebody gave me a chance. And that's another thing that I am very passionate about. Somebody gave me a chance to be where I am today.
Wow.
And therefore I have the responsibility to light candles for others, to ignite others.
Beautiful, I like it. Can you please tell me more about your challenges? The challenges you had all these days, I mean these years.
Well, initially, to be honest, I think it was more about understanding importation and all the challenges with, you know, the just bringing things into a country like Nigeria. Access to finance, which is usually the biggest challenge, was not an issue for me. I had done an executive MBA from IESE in Barcelona, so I understood what was called spontaneous financing. I built a reputation where people knew in my former days with vaccines, they could trust me. So I built that trust, built a reputation, personal responsibility, a personal brand that connoted excellence and responsibility, reputation, reliance, and passion. And therefore, I tried to translate that in everything else I did. And so when somebody gave me that opportunity, when I resigned, I had this opportunity to do a new hospital. They were going to give it to a South African company. I said, look, you've allowed me to do for Huntley, will you give me the chance to do the rest of the equipment? And they said, you know, because you've been so good, no problem. I spent my Christmas holiday doing a quotation. I won the bid, and they paid me 70% upfront. Wow. With that 70% upfront, I didn't need any financing. But that is not the normal story for entrepreneurs.
Yes, this is true.
Exactly. So
can you tell me, how old did you start working?
I started working at 21.
To encourage young ladies. 21, right?
21. I finished pharmacy at 21 in ABU Zaria in northern Nigeria. I did my internship with Sterling Healthcare, which is today GSK. I then did another 1 year with May and Baker. And then I stayed back in May and Baker for 10 years. So I did altogether those 10 years, and then I became country manager for Aventis Pasteur and then Huntley Healthcare. So it was quite young that I started. Yes. But I grew in the ranks from a rep. So I was a sales rep, then a vaccine rep, then a product specialist, a product manager. I was being promoted almost every year. Okay, you know, every year, every other year, until I became the national sales manager for the entire company. Okay, that's interesting. I would like to know again, can you tell me about the advantages? But before the advantages, tell me about your experience. What do you like the most in this? I think for me, it's just making sure that I'm adding value and that we're making a difference in people's lives. I tell people today that even my new staff, when they join, if you know that you're not making a difference and you don't feel you're making a difference, then do yourself and do us a favor and resign. Because this is not a job, this is a calling. There's so much that needs to be done in healthcare. People need to get access to quality healthcare. And we are providing the tools, the equipment for them to work with. But if at the end of the day we don't we don't get the kind of good outcomes, then we're not doing a good job. So that for me is what drives me every day, the passion to make a difference, not only in Nigeria, but in West Africa and Africa, to raise the bar, to bring the latest technology, to make sure we're not a dumping ground for obsolete technology, and then thereafter, create the enabling environment and work alongside others, including the competition.
Yes.
I coined a word called co-opetition. There's a time to compete and there's a time to cooperate.
Wow.
But for us to be able to grow the ecosystem, we must work together as partners. Throw away your competitive spirit, bring together what we can do and grow this market, grow the opportunities together, create that enabling environment, put the right policies. And that, I guess, is what gave birth to then the Healthcare Federation of Nigeria, where I was president. I'm
sure the audience is so pleased to hear you because we're learning so much. But tell us about the advantages.
Well, the advantages really is that, you see, if you work alone, you have limitations of what you can do. But when you work together with others, you can grow the potentials of not only Nigeria, but the whole of Africa, I do believe.
Yes.
And so I've seen that through collaboration, through strategic partnerships, through innovation, and through thinking out of the box, that we can change that narrative. I can see that, and I have proof of that. Very early, somebody about now almost, it's been a long time, 6 plus another 4, so almost 12 years ago, somebody had told me about the Kenyan Healthcare Federation, somebody from IFC, and said, look, there's this federation in Kenya that brings together all the private sector players. And with this, they're able to speak to government and liaise with one voice. Do you think this will work in Nigeria? I said, absolutely. So what do you think? Should we start one in Nigeria? I said, yes. I said, so can you put a list together? We sat, this was on the call, we sat together, put about 30 people together, invited them to one room. I volunteered my office for the first meeting. We all agreed that this was very important, that one of the challenges we have is that private sector is so fragmented, too many voices, government doesn't know who to speak with, and unfortunately they make policies for us rather than us being at the table to make policies together. So that's how the Healthcare Federation of Nigeria started. I wasn't president at the time, but we started this very early and said this is what we do. We kept this going for several months, and at some stage the elders in the room said, look, we need to have leadership. So I said, let's do an election. So we agreed to do an election. And then everybody said, no, why are we doing election? 10 of you have been doing most of the work. Go and lock yourselves up in the room and do an election amongst yourselves and come back and tell us. So they did an election. That was fair. And a few minutes just before the results were coming out, somebody said, why are we electing that? There are certain people who have been leading, and unanimously they voted for one person to be the president, another person to be the vice president, and the rest is history. 6 years I became president of the Healthcare Federation of Nigeria. It was amazing. It was a learning experience. We met every 2 weeks for like the first 6 months to 1 year. And then every month thereafter, had a fantastic exco. We represented all manners of the private sector, and we became a brand that government recognized as the voice of the private sector, providing enabling policies and co-creating those policies.
In West Africa?
In Nigeria first.
In Nigeria first, and then in West Africa?
Later in West Africa. So we met again with Dr. Amit Tucker, who then was the president of the Healthcare Federation, and he had just stepped down as president and said, you know what, we need to get this movement beyond just Kenya and a few countries in East Africa. He then formed the East African Federation and said, you know, why don't we form this as a West African Federation? So we went for one of the conferences, one of the conferences in Kenya, and he says, you know, I will come and support you in West Africa. Where should we choose? So then we chose Senegal, Dakar, and we had the very first conference in Dakar. And
why precisely Dakar?
Well, we had actually, I think the most members that would attend the meetings in East Africa were from Dakar. And we had a very formidable leader who, again, just showed leadership qualities. His name was Dr. Ardoba.
Interesting.
And just watching his leadership qualities, the way he would speak, he was already doing great things. He was the president of the Senegalese association, the PSSP in Senegal. So we said, you know, let's go to him. And he volunteered that he would host. So we went there, we got USAID to support, we had some more donor partners to support the initiative, and we had elections right there and then, and unanimously we voted for Senegal to become the first pioneer president of the West African Private Healthcare Federation, which is FOASPS today in French.
Congratulations.
That's how it started, and I was vice president.
Wow, wow, wow. You know, when I listen to you, I can just see vision. Yeah. So I feel like asking you, what is the next vision?
There's a lot. I think just going from that, becoming the vice president, and 2 years later, becoming president, and being president for 4 years. I'm only supposed to have been having, you know, 1 term, but I had 2 terms of presidency. That for me gave me a big opportunity to say, look, there was so much that needed to be done, so much that can be done. And I must say that one of the things that really helped us was the setup of the secretariat. We have a formidable secretariat headed by Mr. Kofi, and he and his team were amazing. I couldn't have done the work that we achieved in those 4 years without the incredible support of the secretariat, which was Kofi, Maureen, Theophile, Francis, Nandi, you know, amazing, amazing team, supported by an amazing exco. So we had Dr. Lucien Dussek-Beter, who is today, I think he's the DG in the Republic of Benin. And then we also had Dr. Joseph Bogifo, who was the Vice President de, and then later he's become the president.
I'm no more hearing co-workers, I'm hearing a family now.
It is a family.
Okay.
It is truly a family because honestly, I can't speak French. They couldn't speak very good English, but by the time we finished, we were doing French, English, and English, French, and learning everything, and most importantly, sharing notes and helping to co-create what today is FOASPS. But I think the hardest part, because you did ask me what's the challenge, the hardest part was how do we get this sustainable? How do we take each of the various country federations, which were different levels of development, some just starting, some more mature. How do you make sure that all the countries in West Africa, the 15 countries, now really become formidable forces to work alongside the government? And that gave us an opportunity. So I say for every time there's a challenge, there's an opportunity.
Wow.
I am a very positive thinker. I don't think about the glass half empty. I think of it half full. You cannot work in sub-Saharan Africa with so many challenges and think negative. You have to be a positive thinker. And we had an opportunity. There was a bid with USAID to get a grant which would help to do different things. And we wrote a group of us, all volunteers, over 1.5 years, wrote a grant. And that grant today is the partnership we have with USAID, which is the Journey to Sustainability, to build the 10 countries, healthcare federations across West Africa.
Well, I'm still thinking you're hiding something from us, because as I'm hearing you, as I said, I'm seeing vision, and for me, I think you're going to cross even the West African countries. So
it wasn't my vision, it was our collective vision. I just happened to be the lead of the team, but honestly, as I say, one of the success factors is having the vision, but an incredible team to drive it, and also to listening to them so that we're envisioning together.
Wow.
The vision may start with one person, that you buy into the dream, but others picked it up thereafter and continue to light the torch. And I'm really happy, for example, this TV station is one of the things that had nothing to do with me. I just said, that's a good idea, and the team ran with it.
Wow.
So I think that, it's every leader's responsibility to ignite, to reinforce, to reward excellence, and to make sure that you can just keep everybody's passions alive to make a difference in our communities, our countries, and our continent.
And this is a good sentence to finish this broadcast. Thank you, everybody. Do you want to say something to the audience?
I think it's been a fantastic opportunity serving as the president of the West African Private Healthcare Federation. For me, the last 4 years as being president have been one I will never forget. We were able to bring up 10 country federations across West Africa. We were able to close the divide of language, of Anglophone and Francophone, engage our governments to understand that we needed to be a voice at the table. I say to people that you're either a voice at the table or you're on the menu. It is important that private sector understands the role. with 60% of private healthcare in sub-Saharan Africa being provided by the private sector, ministers of health need to understand that they must engage with the private sector. I also tell ministers of health that you're not the minister of public health, you're the minister of health. So everybody must be at the table. And it's great to see the giant strides, especially with the mature countries like Nigeria, like Cote d'Ivoire, like Senegal, like Benin, like Togo, where every meeting that is held, there's a private voice at the table, which is the private healthcare federations in those countries. So together we can make a difference. Together we can create that enabling environment to bring access to quality healthcare, to get great outcomes. I think for us in Africa, the sky is just the limit. We must reverse medical tourism back into our countries, attract more people into the African continent, more investment, greater infrastructure, and together we can make a difference. We can give all the people their rights, which is access to quality healthcare, and bring universal healthcare coverage to every African and around the world, every global citizen. Thank you.
I couldn't finish better this broadcast, so I will tell you just see you soon and bye-bye.